My name is Mr. Niraj Mandal. I'm a consultant ophthalmic surgeon at Cathedral Eye Clinic here in Belfast.
I'm Professor Johnny Moore. I'm anterior segment and refractive surgeon at Cathedral Eye Clinic.
So we're here today to talk to you about primarily patient outcomes and data that we use to improve those outcomes. Regards to the data that we use at Cathedral Eye Clinic, this is primarily geared towards improving the accuracy of our refractive outcomes and in particular getting patients out of glasses with a high satisfaction in their visual quality. Big data plays a huge role in any industry in terms of developing and advancing and moving forward with better outcomes. And here at Cathedral Eye Clinic, we generate and gather and analyze huge amounts of data every day. And I just wanted to ask you, Johnny, in particular, how have you used over the last 15 years all this data to continually improve on patient outcomes?
Yes, Niraj. In Belfast, what we've done is really, firstly, invest a huge amount of both time and effort and money into creating sophisticated data systems and ways to analyze that data. We can directly use the results of thousands of patients over the last 10 to 12 years to better predict what an individual patient that comes through the door, if we carry out treatment A or treatment B on them, what we expect to get. And what this analysis allows us to do and how we integrate that knowledge into our clinical practice is that what you put into, say, a laser, the figures you put into a laser and you treat a particular cornea, you're expecting to get 0 as the result. But you very seldom get exactly 0. And there's a variation, either both undercorrecting or overcorrecting, that will give you some variation in the result. And the beauty of having and being able to analyze this data is that you can create that variation, which may be here, and bring it right down and right down and right down, so that for a particular individual patient, you can modify what you put in there for what you specifically want for them to get at the end of it. And that's why our results consistently have advanced year upon year with both our use of the lasers and our understanding and our own personal expertise as, say, surgeons. But in addition, we've actually integrated and are using artificial intelligence now to integrate the results of these databases and the information within it to predict for individual patients, so that we can do fine-tuning in a way which hitherto, prior to that, we just weren't able to do.
And I think it's also important that patients sometimes grasp the importance of this fine-tuning and understand that lasers are very sensitive to all sorts of environmental and individual factors, humidity, temperature, the presence of perfumes or aftershaves in the operating room, personalized surgeon outcomes. And it often takes at least a few hundred, if not a few thousand patients to really get those refined, accurate outcomes, which you've gathered over the last 15 years, as I understand it.
Yes, thankfully, with the improvement actually in the lasers and the laser technology themselves, that inter-surgeon variation has actually been truncated to some degree, so that certainly in the past, if you go back 10 years, the older lasers, you could have really quite, even though one surgeon appears to be doing the same thing as another, you could get really quite disparate results from two individual surgeons, and therefore the algorithm that you create for each individual surgeon became more and more important. The lasers which we've got in Cathedral, thankfully, their own advanced technology has overcome some of that to a degree. But nevertheless, as we know, each individual person, we're different from another, and that therefore can produce different results. And the key point has been to try, as I've mentioned already, to utilize information we've got in that database that we have, and we've critiqued it, and we've now integrated artificial intelligence to help us for an individual patient coming, how that we can reduce the likelihood of them being outside the error points that they will be happy with afterwards, which will give them supervision, and bring it right inside that, so that with the vast majority of our patients, we can give them really, really high level quality vision. And it reduces the amount of enhancement adjustments that are needed. It means that day one, the patients are exceptionally happy afterwards, rather than it requiring to go for days or even weeks to get maybe the results that they would like to have had. So Niraj, in Cathedral Eye Clinic, we have been lasering now for well over 15 years. What do you think the challenges would be for, say, a new clinic or hospital that was, say, acquiring a laser and starting lasering for the first time?
Well, one of the main challenges is the initial fine-tuning of that laser, getting those settings exactly right for patients in the future. And what this sometimes amounts to is your initial batch of, say, 50 to 100 patients is very important for generating that vital data to make sure you're having accurate outcomes. So the big advantage of any laser clinic, or especially when acquiring new laser, is getting that data as quick as possible, so then you can have more accurate results for the next 100, 200, 300,000 patients.
Yeah, I certainly would concur with you on that. I mean, it's interesting, even for ourselves, we acquired an upgrade to our laser, and what I was really impressed with was the upgraded laser really worked to the same algorithm as our previous laser which we'd had for over 15 years. We basically inputted our algorithm which we created, and particularly, as I say, that integration we have of the artificial intelligence, which really allows us, we put in key data now about our patients, whether it's female, the amount of prescription it is, and the age of the patient. And those three different parameters, outcomes tells us exactly where we should aim for this patient treatment. And we find certainly that has really enhanced our results.
As you said, just inputting our original nomogram, we've generated almost the exact same results that we've been generating for the past 10 years. And I think it highlights, especially in the area of refractive surgery, the importance of data.
Yes.
The importance of the more data you have, the more accurate and the safer outcomes you're going to have.
Yeah.
So Johnny, what would you say the number one appeal is of having your surgery carried out at Cathedral Eye Clinic?
Well, over the last 15 years, we have constantly invested in ensuring that we have the best possible and the highest quality equipment possible to have laser eye surgery carried out. In addition to that, we've invested heavily in our databases and our use of that data to further enhance the results. And on the basis of those two main points there, in addition, obviously the most important part, having our own surgeons, including yourself, now is that they're highly trained in using these. I certainly feel that there's no better place that you could have your laser carried out than Cathedral Eye Clinic.